And welcome back. The questions still coming in about COVID-19 and the state's response. We're continuing our live Skype conversation with New Hampshire State epidemiologist Dr. Benjamin Chan. Next question, Leanne asks, I hear mixed opinions on whether or not to take ibuprofen because it can make the symptoms of coronavirus worse. What is true?
Yeah, this was something that was suggested out of the pandemic in another country, and I don't think we have very much, if any, good data on ibuprofen being a major problem if someone has COVID-19. You know, with that said, this is obviously an area of research that's being undertaken. So if someone has COVID-19 and there are alternatives that can be used, like Tylenol or acetaminophen, it may be preferential to take those over ibuprofen. But if someone needs ibuprofen, that it should be safe from what we know right now to take ibuprofen if needed.
Lisa asks, I had low-grade fever, diarrhea, body aches, mild headache for several days, now subsided, no respiratory symptoms. I read online that in some cases diarrhea is the first symptom of COVID-19. Should I assume I had it?
Yeah, that's always a difficult question, and I think if people have questions about their own health conditions or symptoms, they should call their healthcare provider. We do know that fever can be a symptom of COVID-19, and we certainly have seen gastrointestinal symptoms like diarrhea reported in a minority of individuals with COVID-19. But the vast majority of people, the predominant symptoms that will develop are respiratory symptoms, most often cough. Sometimes people can have upper respiratory tract symptoms. So if someone is having, primarily gastrointestinal symptoms without any respiratory symptoms, it's a difficult call. But I would say call your healthcare provider and talk through your symptoms in more detail. They can provide more guidance.
Diane asks, I am 66 and scheduled for part 2 of the 2-part pneumonia vaccine. Is the risk greater than the benefit if I go to my primary care office to get the shot?
Yeah, again, we want people to reach out to their healthcare providers if they have questions about their own care. Right now we're in this phase of the pandemic where we're encouraging people to remain home as much as possible. And so if there is routine primary care that can be delayed, it's reasonable to delay it, but only your primary care doctor would be the one to make that decision about the urgency. And sometimes healthcare can be provided through telemedicine. But obviously a vaccine is not something that could be provided other than in person.
Mary asks, is there a concern with the virus spreading through public lake water? Are swimming pools okay if chlorinated?
I have not seen any evidence or any data that this virus can be transmitted through lake water or municipal water systems. Again, this virus is going to be transmitted through close contact to someone who's infected and close contact with a person's respiratory secretions.
And Heidi asks, how soon will a test be available to show whether or not you've already had COVID-19?
Yeah, as I alluded to earlier, there are tests that are coming out looking for antibody production. That's someone's response to an infection. You can test for antibodies. Those are in development and being rolled out currently. And so there will be more information coming in the weeks to months around these type of tests.
This is probably the toughest one, Doctor. Amy asks, for people who are co-parenting, is it safe for the kids to go back and forth to each parent's house?
Yeah, that's a difficult question. I think we want people to remain home as much as possible, but we also want families to be able to stay together, whether that's co-parenting and children seeing their parents. Obviously, if someone becomes ill, it's a different story. If someone becomes sick and they might have symptoms of COVID-19, that person should be isolating as much as possible. But we want certainly children to be able to continue to see parents as long as everybody is feeling okay.
The toughest thing of all of our families have been separated during this time. Dr. Chan, thank you so much for joining us tonight. Your questions, the questions were great and the answers were fantastic. So thanks for being with us.
My pleasure. Thank you.